some of my first surgeries were some of the most brutal surgeries, actually. I was in orthopedic surgeries. And if you know orthopedic surgeons or orthopedic surgeries at all, they essentially wear these big, like, sterile hazmat suits. And one of the reasons they do that, at first I was very confused. And people were telling me, hey, you got to stand in the corner. Like, this is the splash zone. And I was like, splash zone?
Everyone, all backgrounds, all ages, all genders, and all walks of life deserve an education.
Dr. Tyrex, thank you very much for joining us for our 2026 Women in STEAM series. It is an absolute honor to have our very first MD on, turned full-time Twitch content creator, Dr. Tyrex. Ma'am, welcome to the show.
Yeah, thank you so much. And just for like total completeness sake, I am a DO, so Doctor of Osteopathic Medicine. So same credentials, same everything, just a different flavor.
Still, again, the doctor that helps people, y'all. Not the
physician type, not the naturopath, that's for sure.
And not
the naturopath.
Not the bug doctor that I am.
Not the bug doctor, not a PhD, but a physician nonetheless.
So, Ty, tell us, what got you into, I guess, the field of sciences, and how did that take you towards medicine eventually?
Yeah, so one of the reasons my name is Tyrex, and so I saw somebody ask if I was a paleontologist. That was my dream job growing up. I grew up on the original Jurassic Park trilogy. Like, I was obsessed with dinosaurs. And so I always found myself gravitating more towards the sciences because I was so obsessed. I really enjoyed mathematics, so kind of anything that was science adjacent as well. I used to watch, people would bully me about it all the time, but I would watch the Discovery Channel exclusively. Like, I wasn't one of those kids that watched a ton of cartoons. I was just like one of the kids that was obsessed with the Discovery Channel, Steve Irwin, kind of anything like natural sciences. And so as I got into high school, I took my very first anatomy course. I took an anatomy and then what was it called? It was like a medical terminology course, and started learning Latin and how to pronounce things and exactly what they meant. And I love Latin. I think it's so much fun to be able to identify a structure in the body and be like, oh, this means this in Latin. And so it's just like a very literal translation. One of my most favorite things. And so once I got into anatomy in high school, I was like, oh, I love this. And just started pursuing medicine from there. Originally, I thought I was going to be a lawyer when I was in like 8th grade, which is such a weird 8th grade want. But then I was like, oh yeah, like I love anatomy. I want to treat people. My mom's been a nurse my entire life too. So I was like, oh, I would love to be a physician. And then worked my way up through college, majored in kind of the typical thing that all MDs and DOs major in, which is biology with a chem minor. And that's exactly what I did. And I also added on a little pediatric research minor as part of what I was doing. And then took my MCAT, which is the medical college acceptance test. Had to take it twice, so no shame in that. I know a lot of people take it multiple times and then get in, to a med school on their second time. Took a gap year to work a little bit as I beefed up my application. I actually worked as a clinical research coordinator at an eye institute, which was a lot of fun. Introduced me to like hands-on clinical research, which I loved. I have so much respect for being published in a peer-reviewed journal. I absolutely love the scientific method and research. And so, yeah, and then I actually came out to Colorado for medical school, and it's kind of wild. So typically medical school is 4 years, and I ended up getting into a scholarship program, which essentially extended med school by another year. So I spent 5 years in med school. And it was called the Predoctoral Anatomy Fellow Program. And so that love for anatomy just kept going. And I got to teach anatomy to first and second year med students, dissect bodies on my own. It was absolutely amazing. I loved that experience so much. Gave a lot of lectures to first and second year med students, kind of acted as a junior faculty. And it was a scholarship program. So it helped me with the student loan burden, which was really nice. And then, because I loved anatomy, I wanted something that was very hands-on, and chose general surgery because of that. I really loved the direct anatomical manipulation that is surgery. I loved being able to help people with my hands. I loved the kind of immediate effect, like somebody comes in with appendicitis. Oh, appendectomy, you discharge them the same day, they feel amazing, and they go home. In some of the more, severe cases, that's obviously not the case, but I loved that there were some surgeries where it was like, hey, I could just take this out for you and you're going to feel so much better. So that's kind of what led me into medicine and the sciences. And I'm just a big nerd, to be honest. I love learning. I still love learning. I love learning about natural history. Still a very big paleontology nerd. chemistry, physics, kind of anything in the sciences. It's just, I think it's the coolest thing to be able to try to understand the physical world that we existed a little bit better. And then also, where that meets medicine and to actually like tangibly and physically make people's lives better. I just think is such a powerful thing.
My one thing you in that story, like from the very get-go that I was gravitating towards, is your love of Latin. That is so important to be good in medical school because of all the Latin termed anatomy. And you're just like telling me I loved anatomy and Latin, and I'm just like, she gets it. She's totally like the doctor to have.
I love Latin. It's so good.
What was it about Latin that made it so fun?
It's so literal. Like once you know the direct translation, so like there are some structures in the body. I mean, this is a German example actually, but there are some structures in the stomach called Magenstraßen. It's one of my favorite words in the world. But it literally means stomach streets. And so they're very straight rugae that are present in the stomach. And I just love it. It's like Magenstraße. It's literally a stomach street. And so you're able to identify that with a word and then literally. And so like there's so many other things like, oh my gosh, let me think of some things off the top of my head. I mean, these ones are a little bit comical. I'm not going to lie. So there's some structures at the base of the brain, and it makes me giggle because it just means that anatomists were just looking at these things thinking, but they're called the mammillary bodies, and they're two little lumps on the front of the brainstem, and they're called mammillary bodies because they resemble mammary tissue. And so, there's just some like very literal translations there that, you can make into either little mnemonics or just like little funny ways to remember things. I'm like a big, like kind of like, I don't know, kind of hijacking your brain with mnemonics and like cheating that way. It's not really cheating, but like kind of hijacking your brain in that way and creating like funny stories in order to remember drugs or structures and things like that. So yeah, I absolutely love that.
It speaks a lot to how your brain has to be wired, right, for this very advanced flavor of science, right? Because you not only have to memorize this absurd amount of information, but then you have to be able to synthesize it as a holistic approach on a patient, right? And I think one element probably reflecting that in your anatomy courses, right? Like when you started to take human anatomy and seeing how everything linked together, presumably that kind of was another like further either eye-opening that this is the thing for me, at least at this moment in time, or could have been very scary, right?
Mm-hmm. Yeah, absolutely. Medicine's a big commitment too. It's like a very linear path. I feel like a lot of other scientific ventures are a little bit more curvy than medicine is. Like you can, kind of dip into one field and out of another and see what you like. Like I was just laser focused on medicine, and I that is one thing I wish I would have done a little bit more is explored some of the other fields that I was really interested in. I took this course and it like changed my life, to be totally honest. It was a vertebrate morphology course in college. And it was the most fascinating course. We went all the way up through the evolution of vertebrates from sponges onward. And I still like, I love correlating medicine and, like the actual like practice of medicine to anatomy, which is so evolution based. And so I'm fascinated by evolution as well and tying that course into like, oh, this is how, the recurrent laryngeal nerve evolved and things like that. It's just, it all kind of like is two sides of the same coin. I wish I would have taken a little bit more of those like evolutionary biology classes back in the day. Just because I was so laser focused, I just wish I would have explored a little bit.
I think it's difficult in med school, right? Or going to med school because you have, the 4 years that you have limited time, and it's like these are the courses that you need, and you need to major in this thing, and there's all the BCPM background courses that you need then to prep for the MCAT, right? There's not really time to discover anything about yourself, and that could be one of the real challenges when going on that route.
Yeah, absolutely. Yeah, and I think that was one of the reasons why, like, I took my gap year, but again, I was just so focused on going to med school. It's just like very prescribed, like, okay, you graduate high school, you go into your prereqs, you take your MCAT, you get accepted, you go to med school, you take your board exams, and then you go to residency, and then and then maybe fellowship, and then you're in attending. And so it is just so like quick as well. And I think there's kind of a lot of pressure in that regard, whether or not it's familial. I did have some familial pressure that was like, go, but also like pressure within the field to like, okay, like, you're not going to be an attending until you're like 35 years old. So you got to go. But what was really cool about the med school that I went to, and I know that there are some other schools like this as well, where like there were some individuals in my class who were like 45 plus, going to school to be, a DO. And it was just, it kind of like rattled me a little bit in that way where I was like, oh, I didn't have to be as laser focused on this. Like I could have like taken some side quests, but oh well, I'm here now.
Speaking of side quests, you mentioned that like while you were in undergrad, you were also looking into pediatric research. Can you tell us a little bit? What was that experience like? What were you doing? Was that also part of the med school journey? Was it there something in particular interesting about pediatrics? What was that driving force for you?
Yeah. So back where I did my undergrad, we had one of the largest pediatric institutions actually in the Western US, which was really cool. And so I wanted some hands-on, not only research experience, but also like hands-on hospital experience. And so what the entire minor, you could actually major in it as well, but what the entire minor involved was we were undergrad students who had like this little office in a pediatric ER. And there were various studies that were going through the medical college, the hospital itself, and some other independent researchers who had questions and they needed actual clinical data to be able to, publish their findings. And so we did everything from vaccinations, from like trauma protocols, like sedation as far as like suturing went and things like that. Like I remember I was part of this like task force that was responsible for like distracting kids who needed sutures and things like that. It was one of those rewarding things. It was sad at times because they were just like, like so scared, but you got to like hold an iPad for them and calm them down. And then by the time they left, they were, all sutured up and good to go. But it was a really rewarding experience. We got to work directly with the pediatric ER fellows and the attendings. I actually got through the process of going from undergrad to med school, you have to get letters of recommendation, which is very standard for, I think, a lot of fields in STEM in order to kind of move to your next phase of life, whether or not that's grad school, professional school, or anything like that. But I got some letters of recommendation written by some attendings down there, which obviously held a lot of weight in getting accepted to med school. But it was my first exposure, actually. Oh, no, it wasn't. I actually had some bench research experience under my belt by this time, but I had done some bench research and it was like endless pipetting, just so much pipetting. And then went into pediatric research and I was like, oh, I really like this clinical research stuff. So that was one of the reasons I wanted to explore it.
What was the big difference between the classic bench work with the pipetting and that clinical side? Was it that you were able to immediately see some kind of impact, right? Because that's really difficult when you work with bugs and pipetting in a lab versus hands-on with the patients. Was that the big rewarding element, or tell us a little bit about what that was that really like spoke to you?
Yeah. So I'm like a very, I don't know, I'm like an extroverted introvert. Like I'm an introvert at heart, but I really like people. And so I liked the engagement. Like when you're down in an ER, there's so much hustle and bustle going on. There are so many like little ways to help. I like to think of myself as a helper. I always have been, whether or not that's like helping, a bug get off the side of the road or, something more substantial, like helping somebody when they get into a car wreck or somebody falls down or something like that. And so there are so many little ways to help in the ER, whether or not that's like assisting the nurses, getting them a pair of gloves, running to the workroom in order to get, like a syringe or something like that. I really enjoyed that. Like that was very rewarding for me to be able to directly help people and then like see it in action. I did enjoy bench work. I worked on this study looking at neuronal generation in C. elegans, which is a type of parasite. And what was cool is that these organisms regenerate very, very, very quickly. I wrote a case report on this actually. And we would create like, they were called, oh my God, it's been like 12 years at this point. Unk. That sounds like a Gen Z slur for older people essentially, but it's like truncated. And we would mutate these, like selectively breed these little parasites and create breaks essentially in their, they have very, very simple nervous systems. There's essentially like two nerves that go from the mouth and then all the way back to the tail. We would take them under this like kind of procedure thing and cut some of the neurons and watch how they regenerated. And the hope was that we could see how these individuals, because they have a fantastic ability to regenerate their neurons. Humans don't have that. And so the hope was that we could translate that from bench medicine into human medicine with things like spinal cord injuries, traumatic brain injuries, and the like. It was a fantastic thing, and we would create bioluminescent rather, C. elegans, and so you could actually see and watch through a time lapse this neuronal generation going on. So that was really cool. And then the other bench research experience I did, I looked at it was single nucleotide deletions in these fish. Oh my gosh, what was the fish called?
Is it zebrafish by chance?
It wasn't zebrafish. It was like I want to say it was like something like ridgeback, something like that. There were these tiny little fish that were native to Utah, and I forget what they were.
That's even cooler. That's because usually, right? Yeah. It's the Danio, right? Zebrafish. So it's like be working on something that isn't a model organism fish. That's even cooler.
Yeah, it was a lot of fun. I did a ton of gel electrophoresis, so much in that lab. It was wild. So yeah, it was a lot of fun, and it introduced me to like the different facets and how research is done. And I just gravitated a lot more to clinical research because of that engagement piece.
Nice. That's it's really cool to hear about that journey, because it's all right. You're having the very logical thinking coming from the Latin and anatomy side of things very early on, like all that building together. And then like the puzzle solving, right, from the research side of things, and that's taking you along your journey. You mentioned there was a gap year that you took where you were doing research as well during that gap year. And you mentioned it was a time to, you had taken the MCAT again and kind of was beefing up your resume. Could you kind of go into, before we talk about that off-year research, because I really want to hear about that, just some of the difficulties in the MCAT for the folks who don't really understand why we have to take the MCAT, and that taking it again and the need to go and take time. Like I went through the MCAT process as well, my sister too, and it really is a hard process. And it's like, you can just give us like some insight on like why that year off was beneficial and how one needs and why one needs to beef up resumes, and just like a glean into how competitive this is.
Yeah. So, getting into med school is hyper competitive. It's a very difficult thing to do. The first time around I had applied, and I kind of just assumed, like, I didn't get a low score. It was back when the score was out of 36, I believe. So this is a while ago. It's out of like 500 and something now. And so I'm not totally familiar with the new scoring system. But I had gotten like a 28, and I was like, I don't know if that's going to get me into the programs I want to look into. And so I took a little bit of time, kind of finished out some of my coursework, focused on like passively studying a little bit, and then I don't think I took the first time I took it as seriously as I should have. And I took it the second time and got over a 30. I think I forget what I got exactly. And felt like I was kind of beefy enough to apply. But I was lacking, like I did have that like bench research component, but I was kind of lacking in the like job research component, if that makes sense. Like I had done the pediatric research and gotten that minor. I just felt like that area of my application was still a little bit weak. And so I decided to go and work. And I also wanted to, like, I had never had like a big kid job before, like a full-time job. And so I did want to get some experience doing that as well, and to be able to kind of beef up my savings account before I went to medical school. So got a job doing clinical research coordinating at an eye institute, and it was full on like clinical trials type stuff. So we did intraocular lens implants. We did treatments for glaucoma. We did treatments for a really rare disease called keratoconus, and it's where the cornea of your eye actually becomes a cone. I think it's an autoimmune disease, if I remember correctly. I didn't go into ophthalmology, obviously, but yeah, really fascinating stuff. And I really enjoyed that. I enjoyed it. It was interesting because I obviously was a full-time student up until then, and I enjoyed working full-time. I really did. It was a different experience. And, I think I could have like honestly stayed being a clinical research coordinator and been very happy. But I was just so excited to go back to school and learn more. I love school. I really do. School is so fun.
What was, when you were doing that research, like with the Eye Institute, what was the hardest part of that? Because, for example, I'm terrified of with having a needle toward my eye, right? And then I would imagine that would also be scary to actually handle that, or even be a visual, no pun intended, to it. As someone who is already interested, right, like in medicine, and you kind of, were kind of gonna be directing towards surgery. My guess is you had a much stronger stomach than I did. But what was like one of those, just like one of the interesting challenges working there, and maybe one of the most rewarding like cases or takeaways to that kind of to that experience?
Yeah. So yeah, the first time I saw an intraocular lens implant, the abbreviation is IOL. It's so interesting because the surgeries are very, very quick. Like the surgeon I worked with could do one in like 6 minutes or something. It was insane. And so, for a surgery to be that quick, I mean, he would just churn out eyes like crazy. And so usually we do IOL implants for things like cataracts and aging. And so what they'll do is they will make an incision, just like a very, very fine scalpel, poke into the area where the cornea kind of meets the sclera, which is the white part of your eye. So your cornea is a very clear, like if you look at an eye from the side, it's the clear kind of like bulge out portion. And you make a tiny incision right there, and then you take what's called a phaco. It's essentially, I think it's like a high frequency sound generator, and you just chomp up the lens, which is a structure that helps focus light onto the actual cells that allow you to see, called the retina at the very back of the eye. And so the lens is actually behind the iris, which is the colored part of your eye. And so we make a little incision, put the phaco in there, and just chomp up the lens. It was a very satisfying procedure, I'm not going to lie. And then all of the intraocular lens implants that we used were folded up in this nice little package, and then they went in through that incision. They'd open on their own, and the patient would leave the clinic. This was all outpatient, by the way, and people were under just a minimal sedation. And they would leave and be like, I can see everything. This is amazing. So it was very, very rewarding in that sense. But the first time I saw it done, I was like, this is terrifying. The things that were the most rewarding, I think, was that piece, was just like the immediacy of results. I think that's probably where I got that high from surgery. Now that I think about it in this very moment, just seeing somebody be immediately, and vision is so important to human beings. So seeing that immediate effect and how cool that was for not only the surgeon, it was very rewarding, but for the patients as well, was awesome. I loved it. I really did.
Yeah, I can't imagine the impact like that you feel when you're doing something like that, right? Because they come in, they can't see, right? You go in 6 minutes, and then they come out and they can actually see again. Like that, there can't be anything more immediate or more striking than that, right?
Yeah, it was so quick.
Yeah, and I mean, I imagine too, like then it's, the years and decades of training that one would have had to do that. It's like, well, that kind of makes it worth the time because you just had such a big impact on that patient. So did that experience feed into, as you were heading towards to medical school, the idea of being a surgeon, or was it like during medical school where you were like, okay, I think this is what I'm interested in?
A little bit before med school. So my mom is actually a circulator in the OR. And so she works in the operating room, and has for the last like 35 years. She's only now just retiring. And my first shadowing experience is actually in undergrad and even in high school. I followed her around in the OR, and saw some of my first surgeries were some of the most brutal surgeries, actually. I was in orthopedic surgeries. And if you know orthopedic surgeons or orthopedic surgeries at all, they essentially wear these big, like, sterile hazmat suits. And one of the reasons they do that, at first I was very confused. And people were telling me, hey, you got to stand in the corner. Like, this is the splash zone. And I was like, splash zone? What do you mean? And I mean, there are power tools in there in orthopedic surgery. It's actually pretty wild. But again, people with total hips, total knees, they walk out of the hospital, which is kind of crazy. It didn't used to be like that years and years and years ago, but we've learned through, there's this thing called ARIS, which is enhanced recovery after surgery. And they've learned that keeping people down after surgery is actually one of the worst things you can do. There are a couple reasons for that. Immobility is awful for the human body. Any type of sedentary lifestyle or post-surgical sedentary lifestyle is very bad for us. Number one, we kind of sit, I mean, I'm sitting like a shrimp right now. I'm not going to lie. We kind of sit like shrimp. And when you do that, the bottom portions of your lungs actually collapse. And we call that atelectasis. And that can predispose you to something like pneumonia. And you don't take as deep a breath in when you're laying down and not moving around. And so that's why one of the reasons why it's so important to get up and move after surgery. I just went on a little tangent, so sorry. Post-surgical care is like one of my jams. But Going into like seeing that component in the OR, like I just thought it was so cool. Like the whole process of getting sterile, getting gowned up, like incisions, like it was such a cool pageantry. I really, really, really enjoyed that. And then when I started scrubbing in, when I was a third year medical student, I think was the first time I scrubbed in. I was just like, this is the coolest thing ever. It's just so cool. You feel really like, I don't know. It feels like exclusive and a little bit special that you're like, oh, I'm in here, like I'm doing stuff. So that was one of the things that really, really drew me to it. And then just like utilizing my anatomy knowledge was such a cool thing to see. Like, oh, I can conceptualize all these structures, but now I'm seeing them in a real person. That was really cool.
I love the description of splash zone. And also, I've had 4 shoulder surgeries with orthopedic surgeons, and you're right, they're always scrubbed up, and I never questioned why, but I'm like, oh God, that's why, because I was splashing.
Yep, the splash zone.
Did you have a favorite before you ended up in medical school? Did you have a favorite shadow experience or surgery where you were like, this was such a cool surgery? Like whether it be because of the end result or just the complexity to it or the method or just maybe it was just weird.
Yeah. Oh my gosh, I'm trying to think. It was more so the people in the OR that made the experience good. Like there's multiple people in an OR. So you have the surgeon and everybody's like, "Oh, the surgeon, that's the boss." Usually not. It's actually the circulator or the scrub tech that's like kind of running things. Like the surgeon's obviously an excellent executioner, not in that way, like executing the procedure. But they like it is a well coordinated symphony in the OR, and it's really spectacular. You have the circulator who is usually an RN. I don't know if you can be a circulator without being an RN. Any RNs in chat will have to verify this for me. Obviously, I was in that particular area. But you'll have an RN as a circulator, and that's the person who's outside of the sterile field who can run like in and out of the room. They do a lot of charting. They verify patient demographics, things like name, date of birth, correct sites. They go and get the patient, bring them back, and then they're there like to call if you need help. To run out of the room if you like end up breaking a glove or need a different instrument or things like that. And then obviously you have the patient who's laying on the table, the anesthesiologist, which is usually an MD, a DO, or a CRNA, which is certified nurse anesthetist, who takes care of putting the patient to sleep. Depending on what type of surgery, there's a lot that goes into anesthesia. You can put people under what's called a MAC, which is a little bit less intense than something like a general anesthetic. General anesthetic means that we completely paralyze you, which means the ability to breathe is gone. So we have to actually put a tube down your throat and intubate you in order to allow you to breathe assisted. And then it also allows the anesthesiologist to more precisely monitor your metabolic processes so that we can keep people who are under safe. And then, so you have the anesthesiologist, which is usually by the patient's head because they want to monitor the airway and also give medications as needed. They have a whole cocktail of medications that they can use if somebody's blood pressure goes up, goes down, if something happens, all of that. And then we usually drape the patient, whatever area is being operated on. That's all done sterilely. And you can have a couple of people in there, like a scrub tech who is actually like certified. They go to scrub tech school, so they can be an RN. Like my sister, for instance, is also a circulator in the OR. She's trained to scrub cases. But there are other people who you don't have to be an RN and you can be like certified as a scrub tech. There are also a bunch of the ortho. I didn't see this as much in general surgery, but a bunch of the orthopedic surgeons I worked with would have scrub assistants. And those are people who are with them on every single case. They honestly, some of the most fantastic, technically skilled people that I met were assistants. And they honestly could have done those surgeries without the surgeon there. I firmly believe that. Excellent professionals. So, that person is plus minus. They're really useful in orthopedic cases, and they can like close the surgical site and things like that. And then obviously you have the surgeon. And so the people who are sterile are the surgeon, the scrub tech, and then if you're at an academic hospital, there will be like med students and all sorts of people who will like be practicing scrubbing and things like that. And then your surgical assist and the surgeon themselves. And so sometimes those surgical sites can get a little crowded, but it's a well coordinated symphony. A lot of teamwork involved, which I loved. No surgeon can do what they do on their own. It would be impossible.
I think the most impressive thing about how you're laying out like all the things that are happening in there is your personal strength that you have to have while in this setting, right? Like you mentioned, this patient can no longer breathe on their own, right? And so we're intubating them and and monitoring the vitals, and right, that that's like the hero level stuff, right, Ty, that the doctors are doing. Could you? How did you, how does one, when they're, young and doing shadowing work or thinking about going to med school, how does one know that they've got that almost like resolution, that stone wall when you're in the ER or when a room of surgery to be able to handle that? Because that's not right. That's nothing trivial about that.
Yeah, I guess I take it for granted a little bit because I've been around it so much. Yeah, you're right. I think that number one, you should know if you're squeamish. If you don't like blood, being in the OR is certainly not where you want to be. The ER as well. Like there are certain specialties that you can go into. Just because you don't like blood doesn't mean you can't be a physician. I would be very clear about that. You can still go into things like psychiatry, neurology, family practice. Family practice, they do a certain degree of they're kind of a jack of all trades. And they get trained in all sorts of things from small in office procedures to things that like bigger procedures that are done like inpatient. But things like psychiatry, yeah, again, neurology, radiology, there are quite a few fields and quite a lot of flexibility that go into becoming a physician if that's really what you want to do. As far as like being a surgeon or an anesthesiologist, being an ER doc, anything like that, I think it's really important to know that like if you don't like blood, those are probably not the spaces for you. For me, it's not that I like blood or anything. I just don't mind it. It's just a thing that happens, and it kind of depends on how your body and your physiology respond. I know some people can have some pretty strong vasovagal responses, which are where you see blood and pass out. Your body's like, I'm outie. And if that's the case, I used to get a little bit squeamish. I think back when I was in high school, maybe, but it's something that has never really bothered me much. And I don't know why, to be totally honest, it just wasn't in my physiology or my mental space. But yeah, like the ability to stay calm and collected under pressure is pretty big. Like things can go sideways pretty quickly in surgery. Not many people like code on the table in surgery, and it's not often that you're in a space where you're doing chest compressions or life-saving measures in the OR. That usually happen outside, and people are relatively stable by the time they get there. Certainly those things happen. It's not terribly often. And so being calm, cool, and collected under pressure, the ability to act logically in situations that can be pretty intense. I think you have to have a pretty thick skin when it comes to feedback. Like these things are happening quickly when somebody is very, very, very unstable. And so you need to have the ability to take feedback and execute without getting, like feeling personally attacked by it. I mean, there are some things, obviously, like things need to stay professional at all points in time, and belittling somebody's intelligence is never okay. But, having somebody talk to you in a curt tone when somebody is actively, coding is it's important that you are able to execute through that. The other thing is, it's there's a bit of compartmentalization that happens, I think, certainly in medicine, where it's an odd phenomenon. Like you are in a place where in the face of extreme human suffering, instead of, I think that some people's natural reaction would be to look away. When you're in a medical setting, a lot of us, we are compelled to walk toward. And I think that's a really strong indicator of whether or not medicine is going to be right for you. It's hard to tell how you're going to react in those situations until you're actually in them. But a lot of the best physicians, the best PAs, nurses, everybody walk toward that, even if it's unsafe for us, walk toward human suffering in order to help. So I forget exactly where I was going with that. The certain amount of compartmentalization. You want to help the individual, but you also have to stay a little bit separate, because if you get over emotionally involved in a situation, you lose all logical, rational thinking. And so that's one of the reasons why they don't allow surgeons or any medical professional like operate on a family member, because once you get your limbic brain, your emotional brain involved, your prefrontal cortex goes offline and you can't think. So that's a really important thing, is staying calm and cool and collected under pressure, the ability to compartmentalize certain situations. And I'm a big mental health advocate as well. I talk a lot about mental health on my stream. It is important that we as physicians, as medical providers, also don't compartmentalize to the point where we just throw that in a closet, never to be looked at again. It's important that we look at those things, we process them as they're happening. When we went through COVID as a medical community, there's a lot of unprocessed trauma there that I've noticed that physicians and everybody who experienced that needs more support on. And it would be really, really nice to see hospitals, residency programs, all of the above support mental health in that regard.
Yeah, I imagine it's very difficult to maintain a good mental health state when you're having to compartmentalize like that, right? Like, you might be that very outgoing person, but if you start getting to know the patient really well, like you said, you can't just be that impartial, kind of what you need for that surgery. And it has to be really difficult and almost lonely at times, right? And it's like, how do you balance something like that? And who are your comrades? Like, is it the other medical students that are with you, or by the time you're out of medical school, who are the people that you're connecting with to ensure that you're not being disconnected from, people? Like, it does sound extremely, extremely tough.
It is. And COVID kind of showed a little bit different of a side to medicine. There was a lot that happened through COVID. There was a lot we were learning in real time. And there was a point in time where, everybody's wiping down their groceries because we thought maybe it's just direct contact, maybe it's droplet. And then it was like, oh, maybe it's airborne. We put masks on, all sorts of things, and learning about this novel coronavirus in real time. And it was a very scary time to work in the hospital. Certainly, we were reusing PPE, which is personal protective equipment for anybody who's not in medicine. We're using N95 masks. It was really wild. There were times where we would go to work, and have trash bags as our equipment in order to care for these patients. And so it was something. The people that I'm very lucky. So my husband, you can actually see his face back here, I think. He's a little bit off screen on your camera, but my husband's a big part of my stream now. He's always been a big part of my life. We met when I was in undergrad. He's not in medicine. And I think that actually helped my experience a little bit, because he has been such a rock and almost like helped me maintain perspective of like what the outside world is and kind of what matters as well. He has been so gentle throughout this entire process and supportive in every step of the way, whether or not that was me entering medicine or leaving medicine. The other people that I confided in a lot were friends in med school who were in the same cohort I was, my co-residents, and then some of the attendings that were a little bit more emotionally in tune. I know that surgeon and emotionally in tune don't really go hand in hand, but there were a couple. And so confiding in people who are, it's almost trauma bonding to a certain degree, where you're like, hey, that was a messed up case. Like we should talk about that. You're supposed to do debriefs after, especially if an individual, particularly during a code. So if somebody flatlines and you're doing chest compressions and things like that, there should be a debrief at the end of those cases to make sure that everybody's doing okay. I remember the first time I saw a code, it was pretty jarring. And I had a nurse check in on me, and that nurse, like I'm gonna try not to get teary-eyed, but that meant so much to me as a baby med student. And so your coworkers are very important, but so is your life outside of medicine. It's very important to maintain connection to people who also aren't in medicine in order to gain perspective, in my opinion. Some people might not share that, but relying on the people around you. Also, big proponent, go to therapy, get a therapist, please. It's so important for you to talk about this stuff.
It's such an empowering way of how you're talking about it too. Like, it's all the more impressive that anyone ever goes into this field, right? And it like really speaks of just how much resilience you need to be able to be there. Because like you said, if you're the first time you see someone go, you're supposed to have someone go in and check on you, but you never really hear that that's the standard. Or I guess outside of you talking to us about this, right? That's not really doesn't feel like public knowledge that you hear about that the doctors are getting support and they're just more meant to be like machines almost in a way, right? Where it's like you're
Yes.
supposed to do this thing XYZ and then just go 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 and there's not the opportunity to have that realignment.
Yeah, exactly. And I think that's one of the reasons why and I don't know, I don't want to like mental health is obviously a cornerstone of my platform. And so physicians have very bad metrics, I'll say that much when it comes to our mental health outcomes. There's a lot of pressure when it comes to this job, just inherently in the job itself, but also societally, familially. There's a lot of expectations placed on physicians, and it can lead people to a really tough path when it comes to their mental health. And only recently, I mean, mental health care in general lags behind physical health care by quite a lot. Mental health, everybody has mental health. Not everybody has mental illness, but everybody has mental health. It is so incredibly important that no matter what field you go into, I mean, all of the fields of science, science, math, and technology, are pretty intense when it comes to some of these pressures that I'm describing. When you're seeing, real human suffering in in real life straight in front of you, we aren't robots, and I think that society and we as a community expect ourselves to be that, and people break under that pressure. And I was one of those individuals who ended up walking away after COVID because I suffered from such severe burnout. Work life balance is sometimes viewed as like a cardinal sin in medicine. It is so important that physicians are able to decompress after they're having these shifts. Sleep is so important, preventing burnout, allowing for activities like exercise, 8 hours of sleep, having a healthy diet, time with family outside of medicine is so important for a person's well-being. And then you add on all the extra stress that being a physician is, and you need to be gentle with yourself. And I think that hospitals, residency training programs, and beyond could do very well by supporting their physicians and their healthcare workers in my nurses. Oh my god, I have such respect for nurses. Like, I firmly believe that there are often times where they do way more than the doctors are. I mean, they are patient facing. My nurses on the floor took some real crap from patients that I didn't have to deal with because I just was rounding and doing so much around the hospital, but they were with that patient 24/7, or 12/5, or whatever their shift schedule was. But I have such mad respect for my nurses and for everybody that makes the healthcare machine work. It is so important that we realize that we're not superheroes. We are people who need to eat, need to sleep, need to experience the sun, and experience joy outside of our jobs, because it is completely and utterly unsustainable to expect us to act like machines when we aren't, under that much pressure.
Absolutely, and really beautifully said as well, Ty. Thank you. What was as we're going to be getting to the point of the story when it was transitioning out of the medical field. Before we get to that, what was something, whether it be during medical school or at least during the beginning of residency, where you look back on it and you're like, that was a really cool experience, rewarding? I know you mentioned the teaching of the anatomy to students, like where you're the one leading the dissections. Is there some like really like just fun, good anecdotal stories where you're like, okay, that was a really, really good time? Because I like, as you were describing the COVID and being in residency at that time, like that just, again, like my hair just standing up, just sounding horrifying. So before we delve down that road, just a little palate cleanser of like,
palate cleanser, absolutely.
Almost something good, right? Where it was like, the teaching element to it, or patience, or I'd love to hear something like that.
Yeah, absolutely. There are a couple of experiences that I had. There was one, so before I got accepted to being an anatomy fellow, so in our entire class, there was only two of us selected, and there was a very rigorous interview process because it was a hyper competitive. It was a hyper competitive program to get into, because they actually paid for the last 3 years of my medical school. And medical school, if you are familiar with it, it's not cheap. And so, as I was beefing up my application to go into this anatomy fellowship program, I did this thing called I chaired this donor memorial ceremony committee. And for all of the individuals who donated their bodies to the medical school so that we, the med students, could learn and dissect, I loved that my medical school did this. We threw a big event where every single person in the class who dissected a cadaver wrote a note about how much it meant to them that this individual donated their body to science, and then we actually shipped that off to the family members of the people who had passed away. I thought that was absolutely beautiful. We held a talent show where students would sing, dance, write poetry, things like that. It was an absolutely beautiful experience, and the fact that I was able to chair it, like I coordinated all of the little moving parts in the year that I did it, and it was just the most beautiful experience, and brought life to, kind of some of the darkest parts of, humans, where, eventually we all, become one with the earth again. And the fact that these individuals allowed us to use their vessel in order to learn, and to help people that are still here was one of the most beautiful things ever. And like, I try not to tear up about it because it's just such a cool thing. And it's such a special thing for somebody at the end of their life to go, hey, I want to help somebody by donating my body to a medical school. It was an absolutely beautiful experience. So 10 out of 10 would recommend that. We actually invited a bunch of different people from an undergrad, like an undergrad, what word am I looking for? Program, to attend. And it was so cool. And everybody was it was a very like solemn experience, but also very like heartwarming and, just beautiful overall, full of art and gratitude. So there's that. Uh, there are some other experiences, like when I went through my rotations, I had one at the top of mind, and now I can't remember what it was. But I've had several experiences through residency where we would operate on people, and there were people that were very, very unstable when I first, rotated onto the unit with them. And there were several who we were like, I don't know if they're gonna make it. They're really, really unstable. And I'd be watching them overnight, and then, a month or two down the road, they're getting discharged. And it was the coolest experience to just see the like resiliency of the human body, how cool technology is, medical technology, evidence-based practice. Like we were like, when you start using like cutting edge medical practice, and you can see it make a difference in this patient versus this patient who is maybe using some older technology, or kind of the way that things were, and then there was a paper published, and you get to use some novel implant or something like that, and see somebody improve just anecdotally from patient to patient. Like that's obviously not enough to write a research paper on, but it is enough to go, oh, like that worked. That's really, really cool. So yeah, seeing patients, I mean, it sounds ironic because I really liked hanging out with my patients, but seeing patients leave the hospital, I was like, yes, get out of here, go out there and be somebody. And yeah, there were a lot of individuals, even through COVID, where, they would have some really detrimental, and just like awful nights, where you would just be like waiting outside their room. Okay, what medication do I need to order? What do I need to do here? And then a month or two later, they'd be gone. It was just really cool. I will celebrate that forever.
Love that. So, hi, you're in your medical school, right? You've gone for the 5 years. You've been teaching people. The next step is picking a residency, right? Can you tell us a little bit what exactly, I guess, does that mean for folks who might not be used to that phrasing? And how
Yeah.
did you pick your own? Like, what was it that drew you toward a particular program?
Yeah, so the process is very, very complicated, and it's weird. I'm not gonna lie. When you'd think like, oh, you graduated medical school, your education's, quote unquote over, even though it's not. Like you just apply for a job and you get it. It's not like that. So when you graduate with either your MD or DO, the entire process of going through medical school is usually structured like this, where during the first 2 years you do didactic in the class learning. So you're just absorbing as much information as you possibly can. And at the end of your second year, you take either the step one or the level one. So the USMLE, which is the United States Medical Licensing Exam, or the COMLEX. I took both because I'm a DO. You essentially accumulate all the knowledge that you've learned in those first 2 years, and you try to regurgitate it on this 9-hour exam, which is insane. And then the last 2 years are usually your rotations. And so you'll actually go into a hospital and rotate through various core specialties. So the ones that were required, and I'm going off the top of my head, I might miss one: OBGYN, general surgery, family practice, internal medicine, and I'm forgetting what, psychiatry. I think that might be it. There might have been 6. But you rotate through these core specialties for anywhere from 4 to 8 weeks. And so surgery was an 8-week one for me. Family medicine was 4. Internal medicine was 8. And so you would go and essentially like see if you like it in the actual hospital. And at the end of your 3rd year, you'll take what's called the level 2 or the step 2. And so that's your USMLE step 2, COMLEX level 2. And that is a lot easier. I'm not going to lie. The level 1 is the one where it's like, this is do or die. These scores are going to go into your final application when it goes to applying for residency, and they're going to determine, along with your other grades, what tier of residency program you're able to get into. Because things like the Mayo Clinic, Johns Hopkins, Mass General, those are hyper competitive facilities. Not to mention if you want to go into a hyper competitive specialty like the RADs, so radiology, anesthesiology, dermatology, and orthopedic surgery, roads rather, not rads, roads, orthopedic surgery. And so those are very, very competitive fields if you want to go into any of those. And you need really high board exams and very good grades and excellent letters of recommendation in order to be accepted, and research, published research as well. So those are kind of the things that go into applying for a residency program. At the end of your 3rd year, you'll take that step 2 or level 2. And by then you should have decided what you want to do when you grow up, kind of thing. You've rotated through all these specialties. Hopefully you've gotten some electives. Like if you know you want to go into anesthesia, then you want to prioritize that, or dermatology. And then at the end of your 3rd year, you'll set up what's called sub-Is or audition rotations. And so sub-I stands for sub-internship. So the first year of residency is called your intern year. And so you do a sub internship. So you're like auditioning to be an intern and seeing how you would actually do as a first year resident. And you'll go to your top programs, do your audition rotations, and they kind of like, it depends on the program, but some of them just let me loose. They were like, hey, you're a doctor now, do something. And it was the most terrifying experience ever. Obviously you have a bunch of people that are behind you, like, hey, I got you. Like they weren't going to let you, like, you can't order medications or do anything that like a real doctor can do, but it was good practice. And it was some of the most formative years, honestly, because I was so scared the whole time, but I grew a lot and I learned how to be independent during that time. And it really set me up for success going into residency. And so you go through those audition rotations, and at the end of that, hopefully you have a list of places that you know would be your top. And so going through the batch process, this is going to be really, really, I hope I make this not difficult to follow. But what'll happen is while you're doing sub-Is, you're also going to be sending out your application through a national kind of database where it will disperse your application to anywhere you want to apply. And then those hospitals or universities or whatever will let you know if they want to interview you. And so then you're going through this interview process in the fall of your 4th year and seeing, what the vibes are of the hospital. You're asking all these lifestyle questions, all sorts of things. They're expressing interest in you. It's like, I don't know, it almost feels like peacocking, where you're like, hey, do you like me? Yeah, I like you. And then there's like this like back and forth. And then the match process happens in March. Actually, it might be actually right now that 4th year medical students are matching into their residency programs. But the way that things go is you plug into a database and you rank from 1 to however many interviews you got. So say you got 10 interviews and you didn't like the 10th one, you don't rank them. But say they really liked you for the sake of this example. So you rank everywhere 1 to 9. And then the programs also have their applicants and they rank them all from 1 to however many. It's always applicant proposing. And so if you have a program as your number 1 and a program has 5 slots and you're in that top 5, you auto match to them. And it's just the shuffle of where you go. And it's this huge lottery. It's a very, very stressful because that week you have no, or leading up to that week, you have no idea where you're going to end up. It feels almost like, I don't know if the Hunger Games is a good descriptor for it, but it's just very, very anxiety invoking. You have no idea what state you're going to be in. Sometimes you don't know what specialty. You hope you match into your preferred specialty. You only will match where you programs that you rank, so you can't just like get slotted into anything. But on the Monday of match week, you find out, did you match? So you just get this vague email from this system that goes, hey, you matched. You have no idea where until Friday. And during that week, so say you get the email and it says, no, you didn't match. You have to go into what's called the scramble, and you will scramble for a position, an open position, if there are any unfilled residency positions in different specialties at various hospitals. And so some of the less competitive specialties like family medicine and things like that will have unfilled positions that you can scramble into if you want to do that. Some people choose to reapply the following year. But it does make you less competitive the more time goes on. And then on Friday, you get I was kind of during the quarantine year, so we get the thing that says, hey, you matched it, whatever. And I matched at my number one program, luckily. And I was very, very happy with that. But some people, they fall quite far in their rank list. And even though they did match, like, it can be a very jarring experience. And so it's kind of a wild thing going through that. And then once you match at a specific place in your preferred, in whatever specialty, so mine was general surgery, you then go into training, like hands-on, you're a doctor training. Various specialties are however many years. So like family medicine, I think, is 4, ER, like emergency medicine is 3, general surgery is 5. If you want to do an integrated surgical program like vascular surgery or CT surgery, it can be 7. And then internal medicine, and then there are like offshoots from that. So if you want to do like a cardiology, if you want to be a cardiologist, you have to go to 4 years of internal medicine and then 4 years of cardiology fellowship. And so it goes undergrad, med school, residency, fellowship, then you're finally a person, you're finally an attending is what we'll call you then. And so it's just this like continuation of your educational prospect. And at the end of your residency program, you can take a board exam and you become what's called board certified. And that's kind of just that's the biggest award, the cherry on top of your medical education. And so, even I didn't finish residency. I'm not board certified, and I'm not licensed. And so I actually make it a point to seek out sources from physicians who are board certified, because that means that they have passed what it means to be a competent individual in their field. It's really important in this day and age. There's a lot of misinformation going on out there. Find the people you trust who are the utmost experts in their field, especially when there are things that might be a little bit confusing.
Yeah, like you're saying, especially in as would transition to as you being a streamer as well, right? And advocating for mental health, I must frustrate you to high heaven about how many people who are speaking with no authority on this, right? And you're the one, not only are you already having this huge amount of training, right? But even then you're like, I'm the one doing the responsible thing and looking up these things and making sure these are the right things and how to talk about them and making sure people know where to get the right help. Even without Twitch, right, and being that part of your life, I imagine that was very frustrating to have to deal with. Every person's the WebMD doctor and telling you what's correct and what's incorrect. Could you tell us a little bit about how you handle that, even now as a streamer, even then as a doctor, and how those two things are different, or maybe they're the same way that you handle them?
Yeah, so that's a great question. I think that, science in general, I think no matter what field you go into, you're kind of subject to the misinformation machine, whether or not it's, wellness influencers or anything like that. I no shade on responsible wellness influencers. I think it's the people who make outlandish claims or spread. I think it's important to find misinformation versus disinformation. Misinformation is the unknowing spread of something that could potentially be harmful. Disinformation is kind of the purposeful, more systemic spreading of misinformation in order to accomplish something. So these are the people that might be selling you something, and they're trying to sow distrust. It's really important that people critically look at their sources, and if they I think that it's important as well for individuals to admit when they don't know. I learned that skill very early on. My kind of go-to statement is I don't know, I don't know, but I will find out. And then I'll go and I'll do research on it and make sure that I'm well informed. There's no shame in saying you don't know if you don't know something. It's so much better than making something up and being wrong about it and potentially harming somebody because of it. And so I always operate out of the lens of education, education, education. I think the more informed individuals can be about their healthcare, about their body, about science, the scientific method, what does it mean to be peer reviewed? What does it mean to be published? What is a meta-analysis? Like, where do these scientific standards of care, what does that mean? Like, why is a randomized double-blinded placebo-controlled clinical trial, why is that the kind of cornerstone of research in medicine? And how do we come up with these recommendations that, like the American College of Surgeons, which is the kind of community of surgeons that makes surgical recommendations and compiles data to recommend to hospitals and universities and things like that. I think it's very, very important for people to know how scientific institutions work, and it demystifies them a little bit. I think that sometimes people, and I view a lot of this out of a lens of like compassion and empathy. I think it's difficult for people to admit like maybe that they don't know something, because maybe that elicits a feeling of shame or guilt that they don't know it, and it's hard, it's painful for them to admit that they don't know, and so they would rather say something than nothing. And I would like to encourage more people to admit when they don't know. I think there's a lot more strength in saying, hey, I don't know, but like, let's find out together. Hey, I don't know, but like, let's go to this person. They're an expert. They've got all the fancy letters, all the credentials. Like, let's find out. There's a lot of strength in that versus, just saying whatever comes to top of mind. I think that when it comes to, spread of misinformation and disinformation, I try to, so when I was doing my research, I was one of the people responsible for the informed consent process. And there's a very specific process that goes into informing patients what is going to happen when they enter into a research study. And patient autonomy rules all. People get to decide what they want to do with their bodies, because like they should be able to, if something's happening to them, if they should be able to decide, hey, I want to undergo surgery or whatever. I will say that with the caveat that people's personal bubbles only extend so far as to when they start to impact other people, especially our most sensitive populations, pediatric populations, people who are undergoing cancer, people who are immunosuppressed, things like that, especially when it comes to public health initiatives like vaccines. And I know that's a really hot button topic, but it's one that I'm very passionate about because there's a lot of misinformation out there. And so I try to come to it from a lens of kindness, compassion, meeting people where they are, and hoping that if I provide somebody with enough evidence, enough information, that I at least spark some level of curiosity. Even if somebody is the most staunch, like, I hate all doctors and all science and everything, I'm hoping that I can spark just a little something. And if I do, I that is a massive win for me. In the streaming space, it can be a little bit tough, and I do set some pretty firm boundaries when it comes to there's a difference between spirited discussion and debate and kind of I don't know, no you, like there's a difference between coming in and just wanting to argue versus having like a discussion about something, especially when it's evidence backed and science based. And so I think the more education and outreach we can do as scientific communicators and medical professionals as a whole will only help. And teaching people what does doing your own research look like? What does going to a source look like? Who do I trust? I think those are questions that a lot of people ask because, man, like it's scary out there sometimes. You don't know who to trust. You don't know. There's so much information and there's a lot of rabble. And so I actually have a little channel in my Discord called Medical Mondays, because I give Medical Monday talks every so often on various medical topics. And I post in there science communicators and physicians that I've fact checked and made sure that they're credentialed, who do a lot of outreach. And I think that's really important in a time like this.
I love that answer so much and your approach to it as well. It's not immediately, whether it be in the streaming space or with your patients, it's not like, hey, get out of here, you don't know what you're talking about. but let me be as understanding as I can of your point of view while trying to inform you about the scientific facts as I know them. And here's the data that backs them up. And at the end of the day, if you don't believe it, I've at least given you the tools to interpret it.
Exactly.
Yeah, I think that's the sign of a great science communicator. And Ty, you do it incredibly. This whole conversation, as we've been talking, I'm blown away by just how strong you are, and I don't know if that comes across to everyone else in the chat as well. But the how much strength you have to be able to go into these fields from the get go, and then also to be able to get out. Can you talk to us about just making it into a positive about leaving that medical field and becoming, the Tyrex that we know here on Twitch? Like, what was that like? What was the decision that was informative to you that this is the time to make that change? And how did you decide it? And why streaming? How did all that come to be?
Yeah. I apologize for my long-winded answers as well. I hope I'm not like taking too much of your time.
As long if you are, I know we want to be respectful of your time, Ty. If you're willing to stay on with us and talk, please. This is so cool to hear about, and I hope that everyone else in the chat too is getting inspired by it blows me away at each thing that you're talking about and your passion behind it. And it's just like, you know what? This is my streamer. This is my doctor too. That's just here, operate on me, fix me.
Thank you so much. That really does mean the world. So yeah, my journey out of medicine. I speak about medicine with a lot of reverence and respect because the field is beautiful. Absolutely. I respect it so much. And I think that medicine is just a beautiful craft. And the human body is fascinating and just so cool. It is so cool to think about how we evolved as humans and to draw things back to everything that we're related to in this world. It offers me a lot of connectivity and compassion for not only my fellow man, but also every organism around me. I feel very connected through that, just as like a little piece of this puzzle of life on Earth. But when I got into medicine, I obviously I'm very excited to talk about it, and I love medicine. I started to realize some of the cracks within the framework of medical bureaucracy that I was spending more time charting than I was with my patients, which hurt me a bit. Our documentation is phrased in such a way to it just takes up so much time, and that's a really difficult part. Things started to really erode for me when COVID ramped up quite a bit. It was hard to walk into the hospital one day and see murals on the sidewalk of healthcare heroes. You guys are amazing, all of these things, and then I had family members who were telling me that I was lying about my experience taking care of patients in the ICU who were critically ill due to COVID. And it was a really difficult time where, I was experiencing one reality and individuals on the outside of the hospital were experiencing an entire different thing. It was one thing to isolate through COVID. It was another thing to have to go into work. I mean, there were times where I would go through the door. My husband works from home. He always has. Not always has. He did after COVID and has since. But I was scared that I was going to bring something home to him, and so I would get in the door, strip, put my stuff in the washing machine, bolt upstairs to shower. To make sure that I wasn't bringing anything home to my family, and I was actually living with my mom and sister at the time, who were also going into the hospital. My mom was anyway. My sister was pre-nursing school, and so it was just a really scary time. And there was just this like disconnect between my life and the life outside, and it was hard to reconcile. Not to mention just the awful things that you experienced. I mean, there was a time in the ICU where I would leave the hospital in the morning because I was on night shift, and there would be a whole new ICU of patients when I got there at night because so many people had passed away. That was really difficult. I'll say that much. And not to mention like the personal scare as well. Like I would go into people's rooms who were actively infected with COVID, not knowing that if I was going to if I was going to end up infected. And at that time, we didn't really know what was going to happen after you got infected. We just knew that, like, older people, younger people, people with, other comorbidities were not making it out of the hospital. And that was really difficult on me. The thing that really got me, and I started to become a little bit more disenfranchised, was that high pressure, high stakes scenario, like situation, can really bring out the worst in your coworkers. And the ways that just how on edge everybody was contributed to a lot of just little jabs and things like that. That in a vacuum, you're like, yeah, it's fine, but add up eventually. Sleep deprivation was a big one. I was working at the very end on just a schedule fluke. My seniors actually told me this after it happened, because I was like, am I supposed to be on this often? And they were like, oh, we messed up. I was on for 18 days straight, alternating days and nights. And so I would work 5 12-hour days, or four 12-hour days, get like the day to sleep, go in at night over the weekends, sleep during the day, and then go back onto it for 18 days. And at that end of that 18 days, I completely broke. I don't know another way to describe it. Sleep deprivation, I think, was really the nail in the coffin for me, where I got to a point where I was so miserable that I was like, I would rather not be here anymore. And that was a really hard reality to face. And I had long conversations with my husband about it. He was very, very supportive. I had a therapist at the time. Not to get too heavy here, but I think it's important to talk about, and it's not super well-known statistic, but on average, one physician per day it commits suicide. And it's roughly 300 to 400 physicians a year. And some of those mental health considerations that I discussed in the very beginning factor into this. Societal expectations, familial expectations, student loan burden, sunk cost fallacy, which is the concept of, you don't want to waste all the time that you've been in, so you just keep going. And it got me to a breaking point, frankly. And I had to humble myself pretty severely and be like, I need help. I did not want to admit that I needed help. Because there's a lot of stigma in medicine, unfortunately. And I think that if you are in medicine, listening to your peers and coworkers, providing a safe space, a non-judgmental space, can be very, very powerful for people. And so I was afraid, frankly, that if I admitted how bad I was struggling, that my whole life would be blown up. And unfortunately, especially in surgery, there still, again, is quite a bit of stigma. And I told my program director and all my co-residents, hey, I'm at the end of my rope here. Like, I need to leave so that I stay safe. And I ended up taking 6 weeks of leave. And through that process, I was, there were a lot of paths open to me. It was the first time where I really felt like there were a lot of paths open to me. I was seeking treatment in the form of mental health treatments through my psychiatrist, and was finally getting medicated for depression and things like that. Medication saves lives. Antidepressants do not make you weak or anything like that, for anybody who is in the audience listening. On the contrary, it makes you very, very strong to admit when you need help. Like, you should not suffer in silence. And so once I started treatment, I gained a lot of perspective, and I was, I had 3 paths that were open to me. I could either go back to the program that I was at. I could go back, finish out my year, and then switch specialties. And so I looked into what it would look like to go into anesthesiology, radiology, dermatology, or something like that. Or I could walk away entirely. And I'm very lucky in that I had the support system that I had. Because looking at it, I found myself at the end thinking, I'm just gonna go through residency. I'm gonna practice for 5 years, pay off my student loans, and then I'm just gonna be done. Because it had gotten to the point where I was pretty miserable in the actual workplace, despite how much I loved medicine. And my husband posed a question to me, and he was like, if you're gonna start over in 5 years, why not start over now? And I was like, whoa, that's kind of crazy. And so I thought I was going to start a small business. I thought I was going to, I still have like the logo and everything. It's kind of my baby. I haven't started it, but I would love to start a mental health apparel company where the proceeds go to mental health organizations. I have a business name and everything picked out for it. I thought that was what I was going to do. And I I was feeling really isolated and alone. And I've always advocated pretty strongly for mental health and mental wellness in med school. And I even had my own like Instagram page. It had like 2,000 followers on it or something like that. And my husband was like, "Hey, you really like to talk about things. You like to talk about your experience in medicine. You like to talk about mental health destigmatization and things like that. Why don't you just go live on Twitch? We've been watching Twitch streamers. You're playing a bunch of Horizon Forbidden West. You're kind of funny when you talk about the game and things like that. Just go live and see if there are people out there that you can talk to, because I know you feel really lonely right now." And I did. And so I went live on a Tuesday. It was April 5th, 2022. And I talked about mental health on that stream. I didn't disclose that I was a physician until about 2 or 3 months later, because I was a little scared too, frankly. But I just kind of fell into this streaming space and found that my advocacy and education still mattered, and that I was still able to help people. And I learned that really quickly. I mean, I've had people join my streams who have said, "Hey, I started therapy because of you. Hey, I utilize one of your mental health resources and I feel so much better now." And to even the degree that some people have said, "Hey, you saved my life, even though you're not, operating on me." And that means the absolute world to me. And so I still feel like I'm doing advocacy, education, and utilizing my background in a way that is beneficial to other people. I think it's powerful. When you walk into a patient room, it's a one-on-one experience, and objectively, operating on somebody is a very tangible experience. But I stream with anywhere between 100 to 200 people in the chat, and I'm able to help 100 to 200 people instead of just a one-to-one. And so I still feel like I'm doing a lot of good. That messaging, or that drive in me to help people, is never going to go away. It is hardwired within me. I think it's from my mom. My mom is a wonderful human who is so incredibly selfless, and has been so supportive as well throughout this whole journey. And so, yeah, you have my husband to thank for why I'm a streamer. And through this journey, it's been a lot of self-discovery. I've leaned into spaces that I hadn't really gotten to explore. Like I said in the beginning, it was I felt like medicine. And so I didn't get to explore my paleontological interests, interest in evolutionary biology. I'm really interested in quantum physics and physics in general. So I read a bunch of books by like Stephen Hawking and Lawrence Krauss and Michio Kaku and all sorts. So I've just been able to explore a lot of different scientific interests because I have a lot more time. And I am so incredibly grateful for my family and my friends, and just grateful for my education. I'm very thankful that I went through that process, even though it was absolutely awful. And I 10 out of 10 wouldn't recommend anyone do what I did. Please go into it. Like, please have a plan when you exit. I didn't have a plan. It was a very like crisisy decision. And so I was kind of making it up as I go. And I'm very fortunate that it all worked out. I have this lovely, amazing Twitch community who is so supportive of not only me, but every single individual in there. And, there are certain constraints with like parasocial relationships that I'm very mindful of. I am very clear that I do not offer any personal medical advice at all on my stream, because the worst thing I could possibly do is harm somebody inadvertently. And so I'm very mindful to draw those boundaries, when it comes to my capacity to help somebody if they are in a mental health crisis. I have tons and tons of resources listed in my Discord. My mods are actually trained to be able to send people, messages and, hey, we're here to help. And I have like chat messages and all sorts of things that are tailored to those situations, because the worst thing I could do is harm somebody. And so I'm very mindful of those constraints, because, I always tell people I might be a doctor, I'm not your doctor. And I think it's important that we as, science educators and physicians in the social media landscape know where our limitations are. Because at the end of the day, a lot of people, especially on Twitch, are just anonymous usernames, on the internet. You don't even know what people look like. And so keeping people safe has been, an ongoing thing for me. I used to do these things called Mental Health Mondays, where I would talk about a mental health topic on Mondays. And the community just started exploding. So I talk about mental health, just not in a specific setting, just because I want to keep everybody safe, and I also want to keep myself safe as far as, you know, my own mental health, my own triggers as well. So it's just I'm so grateful for my journey, and I'm so thankful for the amazing people that I've gotten to meet and surround myself with, like yourself, SciAnts, and you guys are so inspiring. I really appreciate you bringing me on, and all of these, like, highlighting women in STEM. It's a really cool thing, and it's a bit of an unconventional. My journey is unconventional. I know that I think I'm the only physician on Twitch, which is okay with me. But I do my best to provide accurate information, to be helpful. And if even if I'm not doing, you know, educational content, I hope I can at least give somebody a laugh. I'm a very silly individual. I've really leaned into myself, my authenticity, what makes Ty. And you know, I am a very, like, big personality. I'm kind of out there. I've learned that throughout this whole process, that it's okay that I can just be me. I don't have to operate from, you know, Dr. Ty, who's the surgeon. I can be Dr. Ty, but that's a piece of me. Ty is all of this as well. And I think that that discovering who I am outside of that identity has been a really powerful thing.
One of my favorites is Ty Nye, the science guy. Just as an aside, I want Ty Nye to eventually come back. That was absolutely one of my favorites.
I love Ty Nye.
It was such a great, the theme song, just like all of it done together. The dance, like it's a huge testament to your character, right? Because you are so strong. And one thing that you said in your journey too is like that sunk cost fallacy, right? Of how do you know when you're gonna get out? And kudos to Mr. Ty, right, for saying like, well, why not just go now? Because that is the hardest. It doesn't matter if it's in medicine or if it's in like in a PhD route of science, like, or a relationship, right? Any facet of our lives, knowing when you're gonna be like, I need to jump.
Mm-hmm.
And that is to have the support network, number one, to be able to do it, but you as the person to have that strength to be like, you know what, I'm gonna do this. That speaks so huge of your character. And I hope that people recognize that it is a near impossible choice that you're presented with at that stage, that you had to end up taking up doing. And it's just, I'm just sitting here, just like chat's mentioning they're all getting teary, and I'm like, oh my God, like I see so much of like your story in so many people, like piece wise, and having it all together in one person. You're still with us today as like a leader in the field. It's just incredible, right? And it's just such an honor to be able to chat with you about this and have you share this story. We want to finish off on the inspirational notes, Dr. Ty. And one question,
Yes,
maybe a little bit phrased in a hard way, like in terms of it's not a fun topic, but it could be inspirational. As you know, it's our Women in STEAM month. We're celebrating incredible women in the science, technology, engineering, art, and mathematics spheres. And with some really, really wonderful interviews so far, you know, second year doing it, we're raising money for Girls Who Code as well. Can you talk to us about, in your journey, some of the challenges that you faced as being a woman in the sciences? And what advice would you give to women who are thinking about going into your field, whether that be, you know, in the doctor route, in the streaming route, just like your experience of like what you've had happen and what advice that you would give for that next generation?
Yes, I love this. So growing up, I was a nerdy girl. I have always been, and I got bullied for a lot of the time. I mean, I was a girl who was really into dirt and bones and paleontology and all of that. And I really liked math, and everybody's like, "Ew, you love math." Especially if you are a parent, foster those interests in your daughters. I think that, you know, there are a lot of almost like microaggressions that people make toward young girls who are interested in those kind of things, like, oh, you're so nerdy, ooh, he likes math, gross, like all of that. Highlight how cool that is. Oh, you really like times tables? Hey, let's go print off a times table for you so that we can exercise this together. And then, like, when you get it all right, I'm going to be your biggest cheerleader. Things like that. I think that not pigeonholing little girls into girly interests, like they can like to roll around in the dirt and you know, be like, you know, more tomboys and things like that. I think these like gender these like I don't know, these boxes that we put young boys and young girls into can be really damaging for girls who are into STEM, because they have historically been very male dominated fields. And teaching young girls that it's okay to be loud, that it's okay to be passionate about something. It doesn't matter how somebody else is labeling you. If you are very passionate about a certain field or something, you're allowed to be big about it, and take up space. I think it's really important to highlight that even you don't have to make yourself small to make somebody else comfortable. You are allowed to take up the space that you occupy. You are allowed to push the limits of what people think is possible. There is no glass ceiling. It's all a construct, not to be like, oh, it's all a construct, man. But these constraints that we put on women and young girls, they're all made up. They truthfully are. And so once you start to operate out of that framework of, like, oh, this boy is telling me that, like, whatever, I'm not going to get a boyfriend if I'm too nerdy. That's not real. There are plenty of boys out there who are going to want to be your boyfriend because you're nerdy. Like, you can create your own reality, and you don't have to fit within the confines of what other people think are possible. That you are allowed to pursue things just because you're interested in them. I would also encourage just people in general, whether it's girls or boys, explore, play. It's okay if you start out interested in one thing, and then the next semester, the next period or whatever, you're like, I don't like this part anymore. It's okay. There's nothing wrong with pivoting. There is nothing wrong with going the unconventional route, no matter how much time it takes. I think that a lot of people get in their head this, like, idea of, like, societally, what should I do? Okay, by this age, I'm going to have this degree. By this age, I'm going to be married. By this age, I'm going to have a kid. By this age, I'm going to be here. By this age, I'm going to be here. Those timelines are also made up. You are on nobody's timeline but your own. It is okay to take a little longer. It's okay to do things in a different way, the unconventional way, and that you're not behind anybody. That, like, this crazy life is a journey for us all. What's most important is that you're doing something that makes you feel happy and fulfilled. That you feel like you are making whatever difference in the world you want to, whether or not that's through art, through science, through anything, that you feel fulfilled with what you're doing in your own life. There are certainly challenges that come with being a woman in the space. Surgery is a very, very, very male-dominated field. I think only like 20% of surgeons are women. It's like 20 to 30% of surgeons are women. But there was recently a study published by the American Journal of Surgery, I believe. Don't quote me on that one. But it showed that patients who had women physicians as surgeons had better surgical outcomes than those operated on by men. And so when you are faced with any sort of sexism, whether that is micro or macro aggressions or anything like that, a lot of these people are just trying to make you feel small because they feel small themselves, and the only way they can make themselves feel big is by making you feel small. And so, being armed with knowledge is one of the most powerful things you can do, whether or not you're a woman, a man, or anybody who identifies on the LGBTQIA plus spectrum. It's so important that you know that the sky's the limit, that whatever you want to pursue is possible. And don't let anybody tell you that you can't do something just because you're a woman or just because you are XYZ. You are capable of this. You are strong. And you can do truly whatever you want to do. Don't let other people put you into their boxes because they think those things of themselves. Oftentimes when somebody is giving you that type of feedback, they're projecting what they feel about themselves or what they've seen be told to other people who maybe look like you, and they're just parroting that. So it depersonalizes those insults quite a bit, because we do get a lot of hate. I mean, I've gotten hate from being a woman in the STEM fields to being a woman physician, a woman surgeon, now being a woman in the gaming space. It's just kind of a thing that happens. And just know that the people who are trying to make you feel small actually feel really small themselves, and there is something within them that is trying to tamp you down because they're uncomfortable. It's okay to make people uncomfortable, and it's okay for you to step into your power and be whoever you want to be. Like, go out there and be somebody.
I absolutely love that, and I'm gonna be playing back this interview to my little girl too. I'm just
I
gonna be
love
like,
that.
you check this out. She also plays in the dirt, like for fossil hunting and rock collecting, and she loves dinosaurs and reading, and there's not a doll in sight. And you know what? It's like you said, you want to foster that learning and that creativity, and I absolutely love that. Ty,
Yeah.
as we're wrapping up tonight, I think we have to ask, the most important question then of the night, right? And this is a question that we've not only asked all of our guests so far this year, but all of them last year as well. Is, I'm going to put it in the context of you, right? Your journey going from the middle schooler learning Latin class, and learning the ins and outs of Latin to having the anatomical courses that inspire you to continue on to get, your medical degree, going into medical school, doing the MCATs, the gap year before medical school, into the program, getting into residency, going through surgery, having the strength to realize that this isn't the right path for me, pivoting and becoming a successful Twitch streamer. Just right, all of that in 30 seconds is not everyone needs to go back and listen to the interview. This is one of the most inspirational journeys of strength, resilience, and just one of the best people that I could possibly imagine having on. In that journey up until now, everything in the past and everything in the future, you are without question a leader in STEM, right? You are a leader and a role model for women today and women in the future. And so, what does it mean to you, Dr. Tyrex, to be a woman in STEAM and to be a source of inspiration for that next generation?
Oh gosh, it means everything. Like to think I view things out of the lens of I want to be who I needed when I grew up. I want to be a safe space for who little Ty really needed. I want to be I want to be that person because I don't want people to feel the ways that I've felt in my life when it comes to being alone. And so it means it truly means everything to think of myself as a role model to people who maybe don't have that in their life or who are struggling in one way or another, and just to normalize that experience on a human to human level. I mean, we're all people. We all crave connection. Humans are actually hardwired for connection and sociability. Even if you are the most introvertiest introvert to ever exist, human connection is so important. And whether that be connection IRL, online friendships are just as valuable and important or online friendships are just as valuable and important as IRL friendships. I've had friendships that have transitioned from the online to the IRL space. And having people in your life who inspire you, uplift you, is so important to me as a person. And so to think that I could be that to somebody else, it means everything. Because again, I just want to help people. I still want to help people. I'm just doing it kind of the unconventional way.
I can't imagine a person in this chat or anyone who's watching later on who doesn't feel that you're not someone that they can look up to and just really emulate in all avenues of your life.
Thank
I'm
you
just
so much.
Dr. Ty, just blown away. Like truly, you are. I mean, she's one of the best of us. Truly.
Oh, I'm trying not to get too.
Before I get weepy too, Ty, I want to thank you so much for your time tonight, for sharing your experiences with us, for your insight. That was there's no way to put into words how incredible that interview was. Again, thank you. I wanted, please, to ask you, let us know upcoming events that you have going on, things that you're excited about, things that you want us excited about. Please promote everything and anything that you want. And again, I cannot stress how grateful this community is, and I am that you joined us today for this, because this was absolutely
Yeah.
immense and incredible.
Yeah, thank you guys. Thank you for having me. The fact that you are taking time out of your stream schedule, your guys' busy schedule. I mean, your parents, you're superheroes to me. All the parents in chat, you guys are a bunch of superheroes. The fact that you're taking time out of your busy schedule to highlight women in STEM is such a cool thing. And I just hope you guys know how awesome you guys are. And I think the world of you. But I am actually coming up on my 4-year streaming anniversary on April 5th. And so I'm starting a huge streamathon. We usually go, as long as this timer runs out. My community is some serious chaos gremlins. And so I'm going to be starting on April 3rd. I applied for a front page slot on Twitch, and so we'll see if that happens. We plan on going for a max of 20 days, which is a lot, but it's so much fun. It's full of community and chaos. And, I have my husband on stream a bunch. We do a bunch of like little bits together. We've done the Hot Ones challenge, different costumes, cosplays, games, all sorts of things. It's just a time to be together to celebrate the community. And coupled in with that, it's my 3-year partner anniversary. So my 4-year streaming anniversary, my 3-year partner anniversary is both in April. So we just pile them all together, mash them all together for max chaos. And so I've got that coming up. I actually just started a new YouTube channel. It's I think it's in my link tree. But throughout med school and undergrad and everything, I was obviously very, nose into the book. So I missed out on a lot of nostalgic games. And a lot of people in my community have watched me play through like Jedi Fallen Order and Survivor. I'm a huge Star Wars nerd. I love Star Wars so much. And so I'm doing all these first time playthroughs, and people are like, I really enjoy like how involved you are in these stories and things. So I started a new YouTube channel where I am playing through a bunch of nostalgic games that I've never seen before, so that people can relive their first time gaming experience with me. And I'm playing through the Resident Evil franchise right now to try to get through to Resident Evil 9 and Requiem. I'm not going to lie, it's scaring the crap out of me. It's a very scary franchise. I don't think I knew quite what I was getting myself into, but it's been a lot of fun. And yeah, I think those are some of the big things that we've got coming up.
Will there be a pie in the face this subathon? Because I know Mr. Ty did have some last night. And one of my favorite things that he's done in your channel trailer is him saying "ooh ooh." Will we get another Mr. Ty ooh ooh?
Absolutely. He has tried. I don't know what happened during that ooh ooh. It was a second decision, but that came from the depths within him, and he has never been able to recreate it. I have asked him to a million times, and it just falls short. Nothing. It's just like the Jurassic Park movies. Nothing is as good as the original. You know what I mean?
It's one of my favorite parts of the trailer too. It's just because and especially hearing the story that it exemplifies, it's like there's so much more behind the scenes to that ooh ooh, because it's your support network there. It's who's been with you since it's just. It makes it all the more wholesome and wonderful. At the same time, I'd lose it every time I see that clip because it's just such a good one.
Just a guttural ooh ooh. It was actually the way I paused for a second, was like, what was that? That's the craziest thing I've ever heard in my life. Oh my gosh. But yeah, I appreciate you guys so much. Thank you for having me on.
Likewise, Ty, thank you again for your time. Just also opening up the vulnerability, like sharing all these elements to your story. That is not something light. That is not something easy, and to do after a long stream yourself. I can't thank you enough. Thank you again for everything that you've done, not just for this interview, and us as streamers ourselves, but just for the streaming space. It's immense, and I hope with this interview, even more people will go share your story and go check you out on your stream. When's the next time that folks can see you live, Ty?
Yeah, I'll be live at 11 a.m. Mountain Time tomorrow. I stream Sundays through Wednesdays at 11 a.m. Mountain Time, which is 1 p.m. Eastern, every week.
There we go. And guys, in the chat right now and in the show notes will be all things Ty listed out. Linktree, Twitch page. Go check out that new YouTube. Relive your love of the retro games. I know the Star Wars games are my favorite. I love the RE franchise. I'm going to be excited to see those. Just thank you again for everything, Ty.
Yeah, thank you all. Thank you guys for listening. I appreciate you. Thank you, chat. You guys are awesome. So I'll see you in everybody's respective chats.
Everyone, all
thank you, Ty. Have a great evening.
All genders and all walks of life deserve an education. Come be one of us.